Medical Mariner, Inc.
Ladies and gentlemen, coming to you live from our Norfolk studio, home of the Atlantic Fleet, Medical Mariner, Inc.
Hello and welcome to Medical Mariner, Inc. I'm your host, Paul Stewart. This podcast is going to cover my journey in life, some things I have learned. We will talk about medicine, about PA school, about changing careers, about tattoos, and scuba diving, technical diving. Might even talk about skydiving in there, growing things, resilient living, training, anything else that comes to mind. I will attempt to get some folks on here now and then to talk about things with us, and we'll see where this journey goes. Thanks for listening, and now here's today's episode. Hello, and welcome to today's episode of Medical Mariner, Inc. Today, we're going to discuss a little bit about what is a PA, what's the difference between a physician associate and a physician assistant. Spoiler, none. We're going to talk about some organizations that you're going to need to know about when you try to apply to and get into PA school. We're going to talk a little bit about the history of the physician assistant profession and how we got here. We are also going to talk about what are the differences between being a PA, an NP, a medical doctor, a doctor of osteopathic medicine, and why you might want to choose between those. And at the end of this, we're also going to have Nancy come on and give her thoughts a little bit on some things to do with PA school relating to what you should be aware of if you're in a relationship with someone going to PA school and what some of the impacts PA school can have on those relationships, as well as any other thoughts she may have. One thing to get out of the way up front is, are you a physician assistant? Are you a physician associate? And what is the difference between those two? There's actually no difference at all. In 2021, the AAPA decided that the physician assistant title was no longer the best descriptor as what we do, for PAs do much more than just assist physicians. They had a vote. They changed the name to physician associate. Based on that, a lot of the states are starting to update whether or not you call it a physician assistant or a physician associate. Still, most of the places I practice in Florida, Georgia, Virginia, and Wisconsin currently. And those right now, as of this airing in January of 2025, do call you a physician assistant. Now let's talk about some of the resources for physician assistant information gathering. The AAPA is the American Academy of Physician Assistants, and they are the representative body for physician assistants. Their website is www.aapa.org. They offer things like continuing medical education. They do activities like support the PA practice specialty and encourage states to do things to encourage PAs to want to work in those states and make it a better working environment for them. Another organization, AAPA, that is ARCPA, is the Accreditation Review Commission for the Education of the Physician Assistant. Their website is www.arc-pa.org. One of the big things that you need to be aware of here is you want any PA program that you're trying to attend to be accredited by ARC-PA. There can also be probationary statuses. Schools may be in the middle of renewing their accreditation status. So understanding what's going on with your school and its accreditation with ARC-PA is important when you're choosing a place that you want to go to PA school. Another organization and website you're going to need to be familiar with is CASPA, the Centralized Application Service for Physician Assistants. Their website is caspa.liaisoncas.com/applicant-ux/login. This is the website that you're going to make your application to all of the PA schools. You're also going to be able to look at what those schools' requirements are. I'll hit back on this again, but if you see a requirement listed on the CASPA site and you don't meet that requirement, don't apply to that school, because it is a requirement and they just won't look at your application if you don't meet it. The NCCPA, the National Commission on Certification of Physician Assistants, their website's www.nccpa.net. This is where you're going to register for your board certification exam, the Physician Assistant National Certifying Exam, also known as the PANTS. People get confused and think you're talking about a pair of pants whenever you start saying pants and they're not familiar with your profession, so don't worry about that. They also have a repository where every 2 years you fill out what CME you've completed so you can renew your certification and keep that current. And they also are where you'll go to sign up for and take your PANRE, which is your Physician Assistant National Recertification Exam, which you have to take every 10 years. The other group to be familiar with is the PAEA, the Physician Assistant Education Association. They provide scholarships. They have the Physician Assistant Fraternity on there, Pi Alpha. I actually was granted membership into that upon graduation from PA school. And that's a good place to check out, and they have some good resources as well. And if you get into PA school, they're a good place to go check and apply for scholarships. Just a brief history of the physician assistant role. After World War II, American healthcare went through some super significant changes. You had more docs that were moving into specialized areas. Demand was increasing. Employers started to offer third-party payer programs, and we're calling them insurance. We still have those today. Medicare became a thing in 1965. That increased demand even more, but it didn't do anything about the supply of doctors that were on hand to meet that demand. In 1965, Eugene Stead also conceptualized the PA role and opened the first program at Duke University. Duke University's campus is in Durham, North Carolina, and his first class was a group of 4 Vietnam veteran Navy corpsmen, and they graduated in 1967. In the 70s, more programs began. They were focusing on primary care and underserved communities. When I finally graduated in 2017, now you have PAs in all kinds of specialty areas. I do emergency medicine. PAs still do primary care. You have dermatology PAs. You have all kinds of surgical specialty PAs. There's trauma, neurology, basically anything a physician can specialize in, you can have a PA that specializes in that area as well. An interesting thing we'll talk about later is PAs can actually move between specialties, which you may not be able to do so easily in some other medical provider professions. A lot of the ways that PAs are being used nowadays are being driven by changes in demands in healthcare, and that's probably not going to stop. There's no way we're going to keep up with turning out enough doctors to meet the demand for healthcare. So PAs and NPs are here to stay, and it's going to be a big focus in healthcare in the future. Now let's talk about if you should be a PA, or maybe you should choose something else like being an NP or a medical doctor or a DO. If you're thinking about going to PA school, make sure it's going to fit for you. You're going to have a supervising physician in almost every state in the United States. The exceptions to that are Utah, North Dakota, and Wyoming. Also, your international practice opportunities can be limited as a PA, as it's not recognized as a profession in all countries. You will have to take your board certification again every 10 years. That's a requirement going in. A lot of folks get into PA school and they don't like the fact that they have to do that. Well, it's what you signed up for. PA school is about 2.5 years long after you've completed your bachelor's degree and have met all the entrance requirements. That may be a strong consideration and influencing factor if you don't want to have to take the time that it takes to become a DO or an MD. There are some fellowship programs for specialties. They're not required as of yet. These get you more focused training in an area that you're going to be working in. You can also get what's called a certificate of additional qualification from the NCCPA that proves that you know more about what you're doing in that specialty. And some of the programs out there are starting to offer doctoral programs as well. These are usually Doctor of Medical Science and Physician Assistant Studies. Doctoral program is not the terminal degree in this path right now. You can still proceed with a master's degree and get into practice. However, in the future, that might become a reality that you have to be a doctorate level candidate to practice as a PA. Now, if you're already a nurse, you might consider going to nurse practitioner school instead. Nurse practitioners have either a master's or a doctoral program. Usually the master's programs require 2 years of study after your bachelor's degree. The doctoral requires 4 years of study after your bachelor's degree. In some specialty areas, nurse practitioners are allowed to practice without having physician oversight. A lot of the programs out there in the nurse practitioner world are tending towards doctoral programs. I have a friend who recently graduated and he told me that he could not find a nurse practitioner program with a master's degree. Granted, he wanted to stay in this area, so he may not have been looking at programs that are outside the area that may have just that master's requirement. Sometimes the specialty areas of being a nurse practitioner may lock you into or out of practice areas. I do have one fellow that I worked with in the ER. There was something about his NP licensing that he was only allowed to see pediatric patients and not adult patients, and he had to go back and get additional training to be certified to be able to round on and treat adults. If you want to work in a surgical specialty and you don't already have your nursing surgical first assist, NP might not be the program for you unless you're willing to do that. There are a lot of states, Georgia being one of them, that will not let you be a surgical first assist if you are a nurse practitioner and you do not already have a nursing surgical first assist. Their reasoning and logic behind that and why PAs can be surgical first assists is in PA school we do have a core rotation in general surgery, whereas NPs don't necessarily get that experience. And as we said earlier, there are some areas you can practice independently. Another path to consider is being a medical doctor or a doctor of osteopathic medicine. That is an MD or a DO. They're basically the equivalent. Their training's a little bit different, but they kind of go down a similar pathway. This is the path you want to go down if you want to have full independent practice authority. However, it's going to take you significantly longer to get there. And this is why, as PAs at least, we have to have supervising physicians. After a bachelor's degree, medical school is 4 years long, followed by a 3 to 5 year residency and a 1 to 2 year fellowship. If you get into areas like trauma surgery, burn surgery, things like that, you may also need to have more than one fellowship. Trauma surgeons are usually dual fellowship in critical care as well as general surgery. This takes longer, but you get a lot more training experience and knowledge while you're in training, and you get to have independent practice authority and supervise advanced practitioners. Another thing to consider about this way, though, is it also locks you into a path, because if you want to change specialties as a physician, you're going to need to go to another fellowship to get that necessary certification to make those changes. Okay, and now we have my wife, Nancy, who is going to join us and give us some of her perspective about things you should know if you happen to be in a relationship with someone, or more importantly, married to someone who is contemplating or is actually going to PA school. You had some thoughts.
I do.
Seemed like one of the things that you wanted to make sure people knew about that you weren't necessarily, you thought you knew, but then you figured out that maybe you didn't, was that you need to understand what your PA student is going to be going through when they get into PA school.
Correct. It is a huge commitment, which I did understand when you went to PA school. We'd been married not even a year and a half yet. Maybe around almost a year and a half, maybe. So we were still in the honeymoon phase.
But
we still are in the honeymoon phase, almost 10 years later. Yeah.
But you knew I was going into PA school when you married.
I did know that. Yes, I did know that he would be going to PA school, would not be working. That is what is recommended because it's a huge full-time commitment between classes and studying. And I knew it was going to be hard, but I was madly in love and thought, you know what, no matter what happens, we'll work it out. We'll work through it. I think I really just didn't understand that it was going to be as challenging as it was. Obviously, we made it. Yay. One of the first things that was tough on me is we were at, I think, orientation a week or two before you actually started classes. And one of the professors was introduced to me and was talking to me and said something like, so are you ready to be without him for the next 2 years? And I don't think he meant it the way I took it, but I felt like somebody just kind of punched me in the gut. And I was like, be without him, we're married. And so I guess I didn't really realize what everybody there knew who'd been through the program, who was on staff, was that it is quite the journey. And I'm assuming now in hindsight that they have seen turmoil in different relationships as people come into school. And then I feel like it was maybe like 2 months into school, we had started to make friends with Paul's classmates, some of their spouses and fiancés. And I got invited to brunch one morning. I personally thought I was going to be very, very close with all of the spouses and significant others in the class, which was, I don't even remember the percentage of people who were not single, but it wasn't a high percentage. But most of us, ended up being super busy, right? Supporting the household. And
let me insert something here. So what Nancy's talking about, if you guys have listened to any of the other things, is this is the first semester of PA school where you're only doing about 18 credit hours of work. And also, I was the old man in the class. I think the next person that was closest to my age was 10 or 13 years younger than me. I cannot remember which. However, back to your meeting with your friend.
yeah, so one of the significant others from the class asked me to brunch and wanted to talk to me. I thought I was going to be super close to everybody in the class, but everybody in the class is significant other. But life went on, as I was saying, we got busy. Everybody was working and making their own connections because your significant other is super busy and doesn't have a lot of free time. Went to brunch and basically was asked, how are we doing? How are you and Paul doing? Me and my person aren't doing great. So-and-so aren't doing great. And so-and-so aren't doing great. And I was just kind of like, I'm sorry. And she was very concerned that not all of us would make it through this program with our significant others. And, me being a person of faith and also having been married less than 2 years, I was like, we're going to be fine. We're married. And so I just really began to realize it was difficult and challenging. And I know some couples did not make it. And so my best advice would be if someone is looking at going into a program like this or being committed to someone who is, know what you're getting into and stick it out. If you're a praying person, pray. If you have faith, you are going to have to hold on to that.
So after PA school, what are your thoughts on the experience of a newly minted PA going searching for jobs?
Again, if you're a praying person, pray. One of the things about finishing PA school and graduating is it's great, yay. But everybody from your class and classes all over the country are graduating too. So any PA jobs that are available are out there and everybody is looking at all of them. So either they fill up quickly and or you have to go interview places that you may not necessarily have wanted to. live. One thing I did love and very much appreciate, though, is that when Paul was invited to leave the state, we were living in Florida at the time, when he would fly places that were off the beaten path or where they knew we had no friends or family or community, I was invited to go as well, which was really great. Because there are a couple of places I would not have wanted to live.
So we interviewed at 4 remote locations, I believe. Safford, Arizona, Martin, South Dakota, which we got to just in time for fall, winter, Bangor, Maine, and Augusta, Georgia. Out of those 4, which one did you find most interesting and why?
Most interesting? That's a great question. I mean, I think they're all interesting in their own way. But I definitely think South Dakota was most interesting.
And why?
Very small rural town in the middle of nowhere.
It was somewhere. It was Martin.
Well, I mean, in the middle of nowhere, as in 2 hours to Walmart or Target. I don't even think I need to say anything more. Okay.
Which house did you like better in Martin, South Dakota? The blue house or the green house?
Yeah. So basically, Paul went to his interview. We stayed at the one little tiny hotel they had in town. While he was at his interview, I drove around the town to look around because that's what I would do whenever we would go on these trips together. And I think I did like the drive around town in 15 minutes. Literally 15 minutes. And as we bumped into people and met people and said, my husband may get a job here, literally, they're like, well, which house would you move into? The red one or the blue one? Because literally there's no housing. There were 2 houses available.
Yeah, they were green and blue.
Green and blue, red and blue. Well,
obviously memorable.
And I just kept thinking on that particular trip, man, God would really have to be calling us here. Like, just because it was far away from anybody we knew. We did have friends at the time who were in the military who were stationed in Colorado. And I believe the husband was away quite a bit at that time. And the wife was like, you can just come stay with me if Paul gets a job. Just 6 hours and you can see all the weekends or and then I was like, no, where he goes, I go. And so we ended up not going there. But that was interesting. And the trip was interesting. We saw some things we'd not seen in person before. 2 hours from the closest airport too, right? Or was it even longer than that?
It was probably longer than that.
Yeah. When we were leaving there, it snowed. It was snowing in there.
It was ice?
Yeah, it was icy and snowing, yeah.
So,
yeah, that was the most interesting.
What other tips do you have for PA student spouses or significant others?
Be supportive. Pray over them. If you're not a praying person, you're probably going to need to start. Find your own community. One thing I'll say about me is I will do my best to find community for myself. So when we first moved to Florida, when Paul went to school, I started getting connected to people. If I was invited to something, I went. And I knew a lot of people were inviting me to things even though they didn't know me because I was new to town and they knew Paul would be busy. And so I got involved in a local church and I went to a fundraiser that pastor's wife invited me to, met a lady there, started following her on social media, and a few days later she posted that she was hosting a Bible study in her home for women anywhere that wanted to come. And you didn't have to be a member of her church. And I invited myself. To this day, those are the people that became my closest friends, the ones who looked out for me, prayed for me, invited me to stuff. But my advice would be find community and just, sometimes you have to just make your own happiness, right? We all are responsible for our own happiness. PA school is hard. And I will say this, people deploy their spouses all the time, right? And Paul would do rotations, which is a part of PA school. What were you going, like 6 weeks at a time-ish? So sometimes his rotations weren't where we lived. So he'd be gone 6 weeks, he could be home a few days and go back to a different place for 6 weeks. And I just kept telling myself, this isn't forever. total of 26 months, just support them. I would just have to support him and do whatever had to be done, even if it was something he was better at doing than me, figuring out how to manage and budget finances, and just really just having a positive attitude about it. I remember one day Paul was driving away to a rotation, and I was videoing him as he drove away, and I think I posted it on my social media. And I was like, I know I'm being a big baby. People deploy their spouses all the time for more than 6 weeks. And so just realize and know what you're getting into. I definitely knew it was going to be hard, but I didn't know it was going to be as hard as it was. And thank God that I went out and found my own community and friends and people who are still my good friends to this day. Whenever we go to Florida, whether we're spending the night in Jacksonville or passing through, it's the same handful of ladies that I reconnect with.
My bit of advice is get your wife's name tattooed on your arm. That way you don't forget it while you're in PA school. That's going to do it for us today. Thanks for tuning in, listening. If you got anything, comment. And I appreciate you putting up with me getting this podcast started. The background music Perspectives was created by Kevin McLeod at incompetech.com. It is licensed under the Creative Commons by Attribution 4.0 license. The website from which the music was downloaded is http://creativcommons.org/licenses/by/4.0. Thank you for listening to Medical Mariner Inc. Medical Mariner Inc. is written, produced, and hosted by me, Paul Stewart. If you wish to make suggestions for content, leave me some comments, or have anything you would like for me to know, you can email me at medicalmarinerinc@gmail.com. Thank you for listening. To support the show, please give me a 5-star rating on whatever platform you listen on, like, and subscribe to the show. Thanks, and I hope you have a good day.